It's in the name of Deputy Tommy Broughan.
Well, I think the ministers are very well aware that early assessment and intervention is critical for children with ASD and indeed other disabilities. I know Dr. Riley told me a couple of years ago that the Beach Park team were getting an extra 5 posts to try and reduce waiting lists. And I know under Progressing Disability Service for Children and Young People, which the minister also very well aware of, that 21 new posts I think were sanctioned for Dublin North. So basically I want to know where are we at on those positions. I was disappointed last autumn that Minister Riley hadn't filled them, and if they're all filled, and what are the current waiting lists. Thanks again.
Thank you.
Health-related, thank the Deputy. Health-related supports and interventions for children with disabilities, including those with autism, are generally assessed depending on the level of need through primary care and specialist disability services. Information on waiting lists for primary care and specialist disability services is not generally collected in terms of specific disabilities such as autism. While it is recognised that there are challenges in providing children with timely access to these services in the North Dublin area and elsewhere, the Government is committed to addressing this issue through the development of both primary and specialist disability services. An additional 20 million in funding has been allocated to strengthen primary care services and to support the recruitment of over 264 prioritised frontline posts. 49 of these posts have been allocated to the North Dublin area. The HSE is also engaged in a major reorganisation of existing therapy resources into geographic-based teams for children with a disability aged 0 to 18 under the Progressing Disability Services for Children and Young People's programme. The reconfiguration programme is due to be fully implemented by the end of 2015, early 2016. This will result in a more equitable service provision for all children with a disability, including those with autism, in the locality in which they reside. It aims to achieve a national, unified approach to delivering disability health services so that there is a clear pathway to services for all children, regardless of where they live, what school they go to, or the nature of their disability. An additional 4 million was specifically allocated in 2014 to drive the implementation of this programme. This equates to approximately 80 therapist posts, 21 of which have been allocated to support the reorganisation of services in the North Dublin area, and to address waiting lists. Recruitment of these posts is still underway. A further investment of 4 million is being made to support the rollout of the programme in 2015.
Thank you, Deputy Broughan.
Well, obviously it is I do welcome the allocations that have been made, but there is concern, I think, at the speed with which recruitment is taking place, and that we have such a long drawn-out process. Obviously the Minister might report back on that. Could I just ask you, in relation to the independent expert review group, which Minister Riley set up a few years ago to examine the Beach Park model of services, it apparently was nearing its completion last year. Has that actually reported? And is the disability manager for the Dublin North East, for the north side, is disability manager in place who was to manage, I think, under an earlier decision of the government? As I've said before, obviously early intervention and assessment is critical. It is disappointing, Minister, that you don't have data. I think there's a huge lacuna here, a huge dearth of data, as I think Professor Staines' report shows, in relation to the incidence of ASD in the population, the fact that it does seem to be significantly increasing over recent decades, and our, if you like, determination to identify this condition as early as possible and to help children. So while I welcome the point you've made, I think we just do need much more urgent recruitment and actual implementation, and I also need data. The Minister beside you is always talking. He gave me a reply. In fact,
Deputy, I'll let
just
you
a
back
final
in again.
point.
No, I'll let you back in. Yeah.
Okay.
Deputy Minister.
Could I just, in respect of one of the questions that the Deputy asked, in respect of North Dublin Area 9, the HSE Social Care Operational Plan, which is, I think, what the Deputy is referring to, indicates that the local implementation plan is due to be completed by the end of 2015, with full reconfiguration into 12 teams in Q1 of 2016. Could I say, Deputy, that in relation to diagnosis, the 0 to 18s and the progressing disabilities tell us that really it's about the intervention. It's about the very early intervention, that the diagnosis can in fact come later, provided that the speech therapy, the occupational therapy, the type of one-to-one intervention that children specifically with autism will need. It is about that type of intervention. What we have seen in the past is the sort of long waits for the diagnosis whilst nothing was happening. What we're trying to do now is actually put the teams in place. And North Dublin, it doesn't get these posts, more than other areas somehow or other because, we like to look at the place. It's because we recognise that there's a deficit, and that's why it's in there. Recruitment is an issue for us, and the recruitment is taking longer than expected. But then again, the fewer people coming out and qualifying in these areas. But it has been worked on a daily basis.
Thank you.
Thanks, Can. Obviously, the Minister, just the point I asked about the expert review group, and you outlined there a new model of early diagnosis and immediate service provision, rather the other way around, and perhaps you might follow up on that. Yeah, the Minister, just in relation to the overall data on ASD in young people, the Minister, I think I've asked him for a full data provision in relation to 2013-2014 to date in 2015, and I've been waiting some time, Minister, for that, or ministers for that, and Minister Bradker gave me his famous 15 working days, I think, for this, like he used to do in the Department of Transport, but I think I've been waiting for some time for that reply, and perhaps 1 or 2 other replies, so maybe the ministers might follow up. Thanks, Can.
Thank you. Minister.
Very briefly, I suppose it's only at the point of diagnosis that you're going to get the absolute type of data that you're looking for. And if we're now doing the interventions before we do the diagnosis, then that data will take that little bit longer. But that's not to say we shouldn't have it, because I'm a great believer that if you don't know where the need is and what the need is, and you can't absolutely put your hands on that type of data, then really you can't plan properly. But if we're doing it this way, there will be that sort of time lag in terms of how you collect that data.
Thank you. Question number 10 in the name of Deputy Colm Keaveney.